We are group 4, and our case study is video number 12. Our patient's name is OPN vestibulary. All right. So on April 6, 2021, OP vestibulary is visiting our office for a swallow evaluation and a treatment plan. He was referred to our outpatient clinic by his primary care physician. Opie is a 57-year-old English-speaking Caucasian male who is divorced and reported that he has been a house painter for the majority of his adult life.
When looking at Opie's prior medical history, these are Opie's diagnoses in the order that the primary care physician listed from most impactful to least impactful. When reading his file, we discovered that Opie has a history of recurrent upper respiratory infections and right lower lobe pneumonia. This made us think that he may be aspirating since material is most likely falling into the right lower lobe and causing the recurrent infection. Some symptoms that we might see in people with these diagnoses are chest pain, cough, and chills. We have mild concerns surrounding his psychiatric state due to his diagnosis of schizophrenia. This could interfere with the validity of the information he gives us throughout the evaluation. It is also known that some antipsychotic medications can cause swallowing difficulties, so this could be a red flag. Opie has been diagnosed with hyperthyroidism. The symptoms of hyperthyroidism that we might want to be aware of in Opie's case are hypermetabolism, causing the body to burn more calories than it should, causing him to be underweight and malnourished. His diagnosis of chronic obstructive pulmonary disease and asthma, paired with his recurrent pneumonias and respiratory infections, alerted us that Opie already has a lot of lung and respiratory issues occurring, so figuring out how we can make sure he's not aspirating is crucial. It is also important to note that he has allergies to antibiotics, which is a concern due to his recurrent infections. Okay, so looking at his patient complaints, he was referred to our office for complaints of swallowing difficulties for the past 6 months and reported there were bugs in his throat, which was an interesting description that could be due to his schizophrenia or a real sensation that he is experiencing. He also reported that food was going down the wrong pipe and he is occasionally coughing during meals. This was a red flag that he might be aspirating, causing his respiratory infections. However, the ENT did not report any gross findings. Opie also experienced a weight loss of over 10 pounds and the presence of cold symptoms. However, his COVID-19 test came back negative. During the patient interview, we will inquire about Opie losing over 10 pounds and try to gain more information about the cause of his weight loss and use his lab results to determine if he is possibly malnourished. Due to his diagnosis of hyperthyroidism and what we know about its role in speeding up metabolism, causing people to burn more calories than they should, this could be a contributing factor to his weight loss. So during our bedside evaluation, it was determined that Opie is a 6 on the functional oral intake scale, meaning in his case that he is able to eat multiple consistencies except for thin liquids. An oral mechanism exam was administered, but all structures and functions were determined to be within normal limits, although he was observed to have a dry mouth. The cause at this time is unknown. A video fluoroscopic swallow study will be administered to further assess his swallowing difficulties. It's also important to note that he was alert and oriented ×4. Okay, when looking at the medications Opie is currently on, the haloperidol he is taking as an antipsychotic could be a contributing factor to his swallowing difficulties. There are known links between haloperidol and swallowing difficulties. Benzotrophine is used to counteract the side effects of the haloperidol, but some side effects of that medication are blurred vision, dizziness, and dry mouth, which was observed in the bedside evaluation. Methimazole is a medication that is used to treat his hyperthyroidism that can result in low blood platelets and decreased white blood cells, which can be harmful for the body when it's trying to fight off infection. Aspirin 81 isn't used as a painkiller, but as a prophylactic, meaning it is used as a preventative measure for people who are at high risk for cardiovascular incidence and stroke. Some side effects that could be affecting Opie are esophagitis and GERD. The next medication he's on, the celecoxib, is used as an anti-inflammatory for his lumbar stenosis and has some side effects that could be affecting Opie's eating habits like sore throat and loss of appetite. The last medication listed, formoterol, is used to manage his asthma and COPD. One symptom of this is also dry mouth, along with tremor, nervousness, and hoarseness. Each of these medications has a side effect that could be a contributing factor to Opie's swallowing difficulties, but it will be interesting to see when Opie started taking the haloperidol to see if it coincides with when his swallowing difficulties began.
Okay, when we checked Opie's vitals taken on March 23rd, which was the date of his visit with the primary care physician, nothing significant caught our attention. His heart rate, temperature, blood pressure, and respiratory rate all appeared to be within normal limits. When looking at the results for the complete blood count with differential, it became apparent that Opie could have some kind of infection due to the high counts of white blood cells and neutrophil. This is significant, and we want to be cautious to consider this as the management plan is developed. Opie is likely to have an impaired immune response, and the threats of bacterial invasion are more likely to develop infection throughout the body. Additionally, because Opie has a high neutrophil count, we know that Opie's protection against oral bacteria is compromised, and we want to be mindful to include increased oral hygiene in his plan of care. The low amounts of albumin and prealbumin may indicate that he's malnourished and his body is depleted of protein. This could be related to his recent weight loss. Because prealbumin has a half-life of 1 to 2 days, this indicates that he was malnourished at the time of the blood work on March 23rd. And this helps us to determine that it is important to address his nutrition in his plan of care. So when we met with Opie, we spent time asking him questions about how he feels he can swallow solids and liquids, what it feels like when he has food going down the wrong pipe, and how long he has had this sensation. We also inquired about his TBI, cold symptoms, and his history of taking his medications. Opie shared that he felt it was more difficult to swallow liquids when he compared it to solids. And he felt like he has the most difficulty swallowing when drinking water or coffee, but he was unable to really describe the feeling. He said it feels uncomfortable, but he struggled to really describe that sensation. When we asked about his remote TBI, Opie told us that 5 or 6 years ago, he fell off a ladder when at work. He said he lost consciousness for less than 5 seconds, so his coworker took him to the hospital, and there the doctor said he has a mild TBI. When we asked about his cold symptoms, he said that he's had on and off fevers and chills. He mentioned also feeling more tired than usual and having shortness of breath, but he was quick to add in that he had 3 negative COVID tests. We asked Opie how much weight he lost that he's aware of and why he feels he lost the weight. He said he feels like his pants aren't fitting like they used to before, so he knows he's lost some weight, but he's not sure as to why. He says he tries to eat 3 meals a day, but sometimes it's only 2. He says he eats a lot of frozen food meals and oatmeal. And when we asked about his medications, Opie said he takes his pill every morning when he makes his coffee. He said that he's been taking haloperidol and benzotrophine for the past 7 months, which was the most recent change. He explains that he's been taking the other medications regularly for a while now. Throughout our time with Opie, he was a kind man who was very willing to answer any of our questions and complete the swallow study. He followed the directions of all tasks and answered our interview questions appropriately. He did appear to be nervous and was rocking back and forth during the interview, which we felt was a sign of his anxiety. Before we saw Opie, we called the primary care physician who sent the order. We asked the primary care physician questions to determine exactly how much weight Opie lost, inquire if Opie completed the chest x-ray, and ask about his current medications and any potential side effects that may be negatively impacting him. The primary care physician explained that the exact weight Opie lost was 12 pounds. They also said that the results of the chest x-ray did come in, and the imaging did reveal that Opie has pneumonia. They said they were currently treating it with an antibiotic that Opie has not had a history of allergies with. This made sense because we noticed there was an elevated white blood cell count and neutrophil count, which we felt indicated an infection. When we asked about any concerns with medication, the doctor expressed having a concern with haloperidol. They explained that there were documented side effects of difficulty swallowing. When we discussed the concern that the onset of dysphagia occurred around the time haloperidol was introduced, as a team, we decided to trial a new medication. When we talked to the ENT Opie visited, they explained that Opie came in with concerns for bugs in the throat, or bugs in his throat, a year ago, and the ENT reported that they had no gross findings. When we interviewed Opie, he said he has an appointment with Dr. Hines on April 10th, and we plan to follow up with Dr. Hines after the appointment.
So during Opie's visit today, he underwent a video fluoroscopy so that we could have a better look into the swallowing issues he has been experiencing and complaining of. We will show the full swallow study that was taking place today, and then afterwards I will address the concerns that we saw with it. I would like to note when it starts, you'll see barium in his vallecula. This was because before we started the video, we wanted to show Opie what it would be like and what the experience would be like to ease his nerves. So here it goes. Hold on. This looks like the incorrect one. We can. Here it is. Sorry about that. There we go. Okay. So here is a screenshot of some of the concerned areas we